Assalamualaikum and hi everyone. My name is Kamilia and today I will be talking about flat foot and more details will be explained in the next slides. So let's see. What is the definition of flat foot? So, having flat feet, or also known as flat foot, is a condition where one or both feet have a little to no arch. So, when you stand, the pads of the feet press into the ground, and typically you can't see the arch in the foot, though sometimes the arch appears when you lift the foot. So, all babies have flat feet at birth. Arches typically form by the age of 6. So about 2 out of 10 children still have flat feet as an adult. So some adults have arches that collapse. So the condition is also known as fallen arches, is another term of flat foot. The prevalence for flat foot, based on 2022's research, the total prevalence of flat foot was 9.9% on the right foot side, with a prevalence of 6.3% among males and 3.6% among females. However, for the left foot side, the total prevalence of flat foot was 7.3%, with a prevalence of 4.2% among males and 3.1% amongst females. Fit can pose problems whether they persist in childhood or develop in adulthood. So the types of flat foot include flexible, the first one. So flexible flat foot is the most common. So you can see the arches in the feet and you are standing, and the arches disappear when you put weight on the feet. So flexible flat foot comes on during childhood or the teen years. It affects both feet and gradually gets worse with age. So tendons and ligaments in the arches of the feet can stretch, tear, and swell. So the second type is rigid. So a person with rigid flat feet has no arches when standing or when you put weight on the feet, or sitting, no weight on the feet. So this condition often develops during the teen years and gets worse with age. Your feet may feel very painful and can be very difficult to flex up or down or move them side to side. Flat foot may affect one foot or both. Third is adult acquired or fallen arch. So with an adult acquired flat foot or fallen arch, the foot's arch unexpectedly drops or collapses. So it's straight. The fallen arch causes the foot to turn outward and can be very painful. So the problem may affect only one foot, and the most common cause is inflammation or a tear in the leg tendon. And fourth is vertical talus. Some babies have a defect called vertical talus that prevents arches from forming. So the talus bone in the ankle is in the wrong position. So the bottom of the foot resembles the bottom of a rocking chair. So it is also known as rocker bottom foot. There are some symptoms that can show or make you know if you have flat foot. So first is leg cramps, second is muscle pain in the foot or leg, third is pain in the arch, ankle, heel or outside of the foot. So fourth is pain when walking or changes in your gait or the way you walk, and fifth is toe drift. Having flat feet may be in your genes. So as a child ages, arches form in their feet. So some people have high arches while others have very low or nearly absent arches, or also known as flat feet. So some people develop flat feet later in life. The condition sometimes run in families, and certain problems increase your risk of flat foot that includes Achilles tendon injuries, broken bones, cerebral palsy, diabetes, Down syndrome, high blood pressure, obesity, pregnancy, or arthritis. Some of the treatments that can be done if you have flat foot is first foot support. Supporting your feet is usually a first step in treating the condition. Your healthcare provider may recommend that you wear orthotics or inserts that go inside your shoes to support your feet. However, for children, they may prescribe special shoes or heal cups until their feet are fully formed. Second is lifestyle changes. To reduce the pain from flat feet, your healthcare provider may include some changes in your daily routines, for example, exercise programs or diet to manage your weight to reduce the pressure on your feet. Or they may also recommend not standing or walking for prolonged periods. Third is medication. So depending on the cause of your condition, you may have sustained pain and inflammation. So they may prescribe medication to reduce the discomfort from these symptoms. And fourth is foot surgery. It's usually the last option for more serious cases and usually the last resort. What is the long term outlook? So, some people find relief in wearing special shoes or shoe supports. Surgery is usually the last resort, but usually the outcome is very positive. So, surgery complications, though rare, can include infection, poor ankle movement, improperly healing wounds, and also persistent pain. That is all from me. Thank you and bye bye.